Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. Believe it or not, fall is upon us, which means it's time to focus on fall respiratory illness. Autumn marks the beginning of the peak season for illnesses like influenza, RSV, and COVID-19, so we'll focus in this episode on what you need to know and how best to protect yourself from potentially serious illness. Our guests for this edition are Dr. Arti, Chief Medical Officer at the Illinois Department of Public Health, and Briggs, State Epidemiologist, who also works at IDPH. Thank you both for being here. Graham, I'm going to start with you and begin with a question that probably everyone is thinking, which is just how serious are these seasonal respiratory illnesses? It seems like everybody comes down with the flu every year, and these days we almost all know somebody who's got COVID-19. It's pretty common, but it doesn't seem to be as serious as it did maybe a couple of years back. So why the big focus from public health on these illnesses?
Well, thanks for the question, Jim, and thanks for having me today. I think when we're looking at respiratory season and respiratory viruses in particular, with where we're at right now in Illinois and across the nation, we can use this as a way to compare things like influenza and COVID, coming out of the pandemic, to compare and contrast here a little bit. These viruses are common viruses. We're all used to seeing the flu. We've seen that every year, our whole lives. For most people, they don't get terribly sick with the flu. You feel like you're going to die for a couple of days when you've got the flu, but most people recover fairly quickly and get back to normal within about a week or so. And that's not what we saw during the beginning of the pandemic with COVID, but that is more like what we're seeing now with COVID is a respiratory virus that we've built up enough immunity to now, like influenza, that you get sick, you don't feel great for a few days, but for most people, they pop back up and are able to go back to their normal routines within about a week or so. Really, this is related to our acquiring of immunity to COVID over the last couple of years. We've all seen influenza viruses our whole life. Every winter, you maybe get vaccinated, you get exposed that way, but every time you go to the grocery store, pick your kids up from daycare, go to school, all that sort of stuff, it potentially exposes you to influenza multiple different times throughout the winter. So we're always getting challenged. Our immune system is always learning about influenza. What made COVID different was our immune system had never seen anything like that before. And so we had to build that immunity from scratch. That's why there was that big push for people to get vaccinated to make that jump from 0 to like 60, with COVID immunity. And for those that didn't get vaccinated in time, their immune systems had to do that naturally as they got exposed to it. And so now, as people are continuing to get exposed to COVID, continuing to get vaccinated for it, we're building up that immunity similar to what it looks like for flu. So even for those that don't get vaccinated now, or for those that choose to get vaccinated this fall, all of that is increasing this population immunity, which means that people are still getting COVID out there just like they get flu, but we're seeing less and less hospital admissions, we're seeing less and less deaths and severe disease, and that's really because of that built up immunity. Now, it's worth mentioning, though, still, we've got a little bit of a tolerance in society to respiratory viruses. In a typical respiratory season, somewhere between about 20 and 50,000 Americans die of influenza every year. So that's something like car accidents where we see deaths, but we're sort of habituated to it. Just in Illinois in 2023, the last full year that we have data for, we still saw 2,100 deaths due to COVID just here in this state. And so there are still people that are at higher risk. We need to be keeping that in mind. For those of us who are generally healthy, we need to be thinking about the people that might be on chemotherapy or have immune systems that don't quite work as well as some other people. And for those people, they still are at a little bit higher risk and want to keep that in mind, as they're making decisions out there in the public.
A really important point, and we'll delve into that a little bit more in just a moment here. For all the tools we have at our disposal in public health, a crystal ball generally isn't one of them. But Graham, I'm going to ask you to break yours out for a minute. What's the best assessment we have right now of the outlook for this upcoming fall respiratory season? How bad could it get?
I would love to have a crystal ball. If anybody has one, a spare one around, feel free to send it my way. But in the meantime, what we have is better and better technology that allows us to forecast activity that is coming in the immediate to near to medium term future. And so we don't know for sure. We can't say absolutely we know what's going to happen, but based on the forecasting that CDC is doing, we think that we're going to have a potentially a similar season to what we had last year, maybe a little bit more mild, depending on how COVID and flu look as far as transmission goes as we really get into the season. But the hope is not any worse than last season, maybe a little bit better.
I want to bring in Dr. Arti Barnes, now Chief Medical Officer at IDPH. And Graham alluded to this already, but if you could talk a little bit more about the three main illnesses that we're thinking of when we're talking about respiratory illnesses: influenza, COVID-19, RSV. How are they different from one another? What do they have in common? And Graham also talked about this, but who really is at highest risk from these illnesses?
Great question, Tim. So COVID, as we've experienced over the past 3 years, has started changing how it attacks our body. Right now, what we're mostly seeing are symptoms related to cough, sore throat. We do have people who may have fever, but fever and body aches are far more likely to be seen with flu than COVID. Now, one big important thing to know is you can see all the common respiratory symptoms: fever, sore throat, cough, difficulty breathing, wheezing, with all of the three main respiratory viruses. But RSV specifically causes a lot more wheezing than the other two, flu or COVID. So it's almost impossible to tell just based on symptoms at this point in the game that, hey, I'm sure this is flu, or hey, I'm sure this is RSV or COVID. So the best way to think through this is to make sure you get tested, especially if you are at risk or you are around people who are at high risk for bad complications. And you could get treatment, but treatment has to be timely. So getting tested would be important to differentiate the three. And to your second point about who's at higher risk, so for all three, when we get older, that puts us at greater risk. So those who are above the age of 60, 65 are ubiquitously at risk for flu, COVID, and RSV. And what we really want people to know that there are also other risk factors, right? People who are maybe younger but have weakened immune systems. They're on cancer chemotherapy. They have disabilities, and they're more likely to then have underlying medical conditions or live in congregate settings. Now, pregnant people are at risk for flu and COVID. RSV is not necessarily as much a risk to a pregnant person, but it is a risk to the baby. So we want the pregnant moms to still get vaccinated for RSV. And, very young children are at risk for RSV. Children under the 8 are at risk for flu. So, you at the ends of the spectrum, you have the very young and our aging population that are much at risk. And of course, if you have underlying medical conditions like chronic lung disease or heart disease.
One of the things we know for sure is that the best way to not get seriously ill is to not contract one of these illnesses at all. So let's focus on prevention. We've heard a lot about immunization as the best defense. So just how safe and effective are the various vaccines against these illnesses?
The COVID vaccines that are out in the market are extremely effective in preventing serious illnesses and hospitalizations and deaths. And that's the important thing to know. They only work if you're actually infected. So they don't necessarily prevent infections. They actually prevent severe disease. And so COVID, 70 to 90% effective in preventing serious disease. Same with RSV, about 70 to 90% effective. Flu is about 50 to 60% effective each year. Often with these, we find out at the end of the season or in the middle of the season what the true efficacy or how good they really are when we test it out against people's natural immunity and again, how virulent or how serious the circulating strains are.
You're listening to This is Public Health, a podcast from the Illinois Department of Public Health. Our guests are Graham Briggs, State Epidemiologist, and Dr. Arti Barnes, Chief Medical Officer for the Illinois Department of Public Health. Arti, in every conversation about immunization, we have people who raise concerns about potential risks from being vaccinated. So, is there a risk from any of these vaccines, and how does it compare to the risk of not getting vaccinated?
There is always a small risk of potential side effects from vaccines. For the most part, these vaccines are extremely safe. I say this as someone who has gotten herself vaccinated and her family vaccinated. The risk of not getting vaccinated is so much higher that is really no comparison. Vaccination not just protects you from COVID and serious illness from COVID, it protects you from long COVID symptoms too. And it's one of the most powerful protections from some of the big unknowns with long COVID. Like, we don't know necessarily what triggers it and why people suffer for years. So vaccinations have a lot of untapped benefits, a lot of far-reaching benefits. And also with flu, the same, even though it may not be considered as effective as COVID or RSV, it still prevents thousands of hospitalizations every year. So yes, there are very small risks. We monitor those risks both nationally and locally. There is something called the Vaccine Adverse Event Reporting System. And so we actually review any adverse events that occur from these vaccinations.
So where can I get the various vaccines? You would think you'd just go to your doctor, but it isn't always easy to get in to see your doctor. Some people maybe don't even have a doctor. So what are the various options to be able to make sure you get vaccination in a timely manner?
So one thing, pharmacies are also offering vaccination. So if you go to vaccines.gov or just go to your local retail pharmacy website, and type in you're looking for a COVID, flu, RSV vaccines, you can get in there without needing to see a provider first or without needing a prescription for the vaccination by your provider. But you can also go to vaccines.gov and just put in your zip code in there and it'll tell you where in your neighborhood you can get these vaccines. So you can go to vaccines.gov, you can go check out your local pharmacy, and that's of course if you don't have a provider and your provider's not able to provide this vaccine in a timely manner.
And again, that web address, vaccines.gov. I want to bring Graham Briggs back into the conversation now, and Graham's as an epidemiologist. What are some of the other preventive measures that people can take? I think back to the early days of the pandemic, and we heard so much about hand washing, masking, social distancing, which nobody ever really talks about anymore. So what are the best practices that you would recommend to give people an extra layer of protection against these seasonal illnesses?
All right, thanks for the question, Jim. So I think it's important to keep in mind that COVID, like influenza and RSV, as Dr. Barnes was talking about, are around, they're out there, and we believe that they're going to be for the foreseeable future. So unfortunately, these are viruses that we have to learn to live with. And so for different individuals, that might mean different things. And so again, for people that are young and healthy, even if they choose to not get vaccinated, they might get sick and get better fairly quickly. But what we get concerned about in public health is if that 25-year-old goes over to their grandparents' house for Thanksgiving or for Christmas, they might accidentally expose somebody who is at higher risk. And so one thing we really want to encourage people to be thinking about is not just vaccinating for themselves to protect themselves, but vaccinating to protect their loved ones. If they've got elderly people at home, immune-compromised people at home, young infants, that they're around. That's something to keep in mind to help protect those people around you. Then another big thing we want to keep in mind, just like we do with flu and RSV and other respiratory viruses as we get into the fall and winter months, is that if and when you do get sick, stay home. It doesn't matter nowadays if it's influenza or COVID or some other respiratory virus, but if you've got a fever, a cough, when you don't feel great, and same thing goes with with people that have kids out there. Consider keeping your kids home, stay home from work, try to minimize your exposure to other people as long as you have that fever until you go 24 hours without fever reducing medications before you start acclimating back into normal life. And as a parent myself, I know it's kind of easy some days to say, oh, they're fine, just push them out the door. But that's something we want to really be thinking about is trying to not only protect ourselves, but to protect the people that we're around that could be at risk, and to try to really suppress that transmission as much as we can in the community by doing things like staying home, getting vaccinated, limiting exposure to other people. Ultimately, the safest thing we can do to avoid all viruses together is live in a bubble. But very few humans, I think, want to live in a bubble or realistically could do that. So we need to learn how to live with these viruses alongside us, how we can best protect ourselves, and how we can reduce risk for both ourselves and for those around us in the communities that we live in. So some of those standard things like washing hands, staying home when you're sick, eliminating exposure, in particular to people that might be at higher risk, or all things that we want to practice. Basically throw COVID into the mix like we do with flu and RSV as far as these sort of hand washing, covering your cough sorts of stuff goes.
We are out of time, but I want to thank you both so much for this important information, very timely as we head into the fall and the fall respiratory season. Our guest, Dr. Arti Barnes, Chief Medical Officer at the Illinois Department of Public Health, and Graham Briggs, State Epidemiologist with IDPH. Thank you again both for being here. Please join us next time for another edition of This is Public Health with the Illinois Department of Public Health.